think, yes, the curing ability of Ayurveda is irreplaceable. That is why people are holding it in a special position.
And
Correct.
how do you approach a person when somebody comes to Ayurveda?
See, Ayurveda basically we check your nadis. Nadis are the one through which we come to know your body constitution. What are you made up of? Many a times, just by checking the nadi, we can say that in due course. Like if you are not diabetic now,
Like if somebody, like you say nowadays, a very common issue is the BP issue.
I don't say that Ayurveda can cure if the BP is very high. See, and very high, and he or she has been taking medications for a very long period, and you come to us after 15, 20 years of taking so much of medication.
Welcome everybody to another episode of Facebook Live. In my series of special guests, today I'm bringing in another special guest, a very, very special guest. We have been talking about astrology, yoga. Now, today I have a very special, different modality. Today we are going to talk about the ancient, but a very, very important topic of Ayurveda. It's not just about herbal medicines or remedies, it's an holistic approach of our life that integrates our mind, body, and spirit. Despite effectiveness of this medicines, of this modality, it has been morely overlooked and it has been forgotten in this technical era. So we have one of the famous specialist in Bangalore who is into this Ayurveda for more than 15 years and cured thousands of patients. Let's hear from Dr. Sindhu Prashant. Ma'am, welcome to the
Namaste.
podcast.
Namaste to all the viewers. Namaste to Krishnaveni
Namaskar.
for giving me this opportunity to speak about Ayurveda and myself.
Thank you. Thank you for taking your valuable time and sharing your knowledge with us.
Pleasure.
Tell me, when did you start practicing Ayurveda?
I started practicing Ayurveda from 2010 onwards. So it's been
2010 onwards.
almost close to 15 years now.
How has been your experience of Ayurveda then and now? Has it changed?
Yeah, of
How do you?
course. It has been changed a lot. Nowadays, people are more aware compared to before COVID. Before COVID, people just used to overlook it as thinking that it has nothing to do with us,
Hmm.
like well-being kind. It could be immunity wise, or it could be taking care of oneself. It was overlooked, but now it has changed completely. People are taking it serious. People know the value of Ayurveda now. More importantly, they're getting awareness. They know what are the side effects of the multiple disciplinaries if they go. And
Why
they
do you
do.
think these ancient sciences have been left out in the middle? Now we are, like I'm into Vastu and you're do Ayurveda. All these ancient sciences, we are coming back in this modern technical era. What do you have to say about it?
See, one thing, there are two things what happened in the history. One was, of course, the British invasion. The second was the Mughal invasions. We lost all this Shastra. You would be knowing that Nalanda University burnt for
Yes,
3 long
yes,
months continuously. And all our
yes.
treatises, it could be Shastra based, any of the treatises, astrology, say it aeronautics or something, whatever we had Shastra derived,
It
all of
got
it
lost.
were preserved in the manuscript in one particular place. And that particular place, Nalanda and Takshashila University, they were
Yes,
devastated completely. So that is where we lost Ayurveda. So many of the manuscript burnt, even without the knowledge of whatever we burnt. We don't know whatever we had that was remnants of Ayurveda now. And again, the second most important thing which affected Ayurveda or any Shastra would be when India got independence, none of the people were in the position to uplift these Shastras.
yes,
They were only thinking about getting independence, but never thought that our Shastra should be uplifted simultaneously. They accepted the Western things easily, living our own Shastras. So that is the where these two places are the things why all our Shastras started suffering. And now that people are getting knowledge about that, they know these Shastras are the answers for modern age. Any kind of ailments or any kind of mental peace or whatever you say, all the answers is in our Vedas and Shastras.
yes. You rightly pointed out about the Nalanda University, wherein all our ancient treatises were lost. Only few things could be preserved at that time.
Correct.
As you said that you have been practicing Ayurveda for last 15 years, what difference do you see 15 years before, and especially how the Ayurveda is bouncing back? People are getting trust in that. Alas, I also see in last few years the trust of the people in ancient sciences are coming back.
Yeah, one thing, yes, the curing ability of Ayurveda is irreplaceable. That is why people are holding it in a special position. And lot of cases, like, if you go back to 10 years before practice, not just with me, with any of the people in and around, PCOS or say about any mental disorders or mental depression, anxiety, whatever terminologies we are giving today, were rarely
Right.
seen. Or even if it was seen, it was very limited.
Hmm.
In a family, one person, in a community, one or two-person were suffering from PCOS or something. And nowadays it has become
It's
so common that
very
every other female, even if she is 16 years, we are finding PCOS as very common in them. And the Ayurveda is the only answer for that. See, whatever kind of ailments we are seeing today, it is mainly two types. One is immune dependent, and
hmm.
other one is due to the metabolism. And for both of the things, we have excellent Ayurvedic formulations for that. It could be Panchakarma therapies for that, which works wonders in all these cases. That is why people are more approaching towards Ayurveda.
Like we see when we go to normal doctor or some normal the allopathic medicine, when we go for some ailment, there are a lot of number of tests done. And how
Correct.
do you approach a person when somebody comes to Ayurveda? Because in Ayurveda we don't do multiple tests as far as I
Right.
know. Because here we do blood tests, cholesterol tests, there are multiple tests. With most of the tests we don't know the name even. So how does Ayurveda approaches?
Ayurveda basically we check your nadis. Nadis are the one through which we come to know your body constitution. What are you made up of? And again, Vata, Pitta, Kapha, it depends
Yes,
on your nadi. And that Vata, Pitta, Kapha depends on the five elements, Panchamahabhutas itself. So based on
yes,
that, I don't say that going through the diagnostic things would be wrong, because when you have a privilege of getting it, get it done.
yes.
To know the values, not a issue with that. But many a times, just by checking the nadi, we can say that in due course, like if you are not diabetic now, maybe in and around 6 months to 2 years,
Yes.
you are more prone to develop diabetes, or you are more prone to develop lipoma, or any sort of PCOS, any sort of metabolic skin diseases. You're more
So
prone.
you're telling that we can at least know that in after 6 months what would be the state of your health
Correct, correct,
by the
correct.
nut.
So, and nadi is one thing by which we can adjust your body food intake also. So, by adjusting the food intake, again, we can see to that the diseases doesn't approach you soon. So, it can be prolonged process. Like,
See, just
even if you have a hereditary issue of diabetes, maybe
Mhm,
taking care of diet and doing lot of lifestyle
mhm.
modification, maybe the diabetes would come to you after 10 years, not just right away.
Not
So all these modifications, we can easily do it with just Nadi Pariksha itself.
like if somebody like if you say nowadays a very common issue is the BP issue.
Hmm.
Like we say and read, and I know it is true also that in through Ayurveda BP can be completely cured.
Correct.
Whereas in allopathy we say once you start taking medicine for BP it is lifelong. That is the perception. Do you
Hmm.
want to say something about that? That how
Yeah. See,
BP can be cured through Ayurveda?
I don't say that Ayurveda can cure if the BP is very high. See, and
Hmm.
very high, and he or she has been taking medications for a very long period, and you come to us after 15, 20 years of taking so much of medication. Maybe at that point, none of the disciplinaries would be able to help you. So, as soon as you get there is a high blood pressure in you, as soon as you are diagnosed with that, please come to us. And Rakta Chapa is something, blood pressure, which is already dealt in the Shastras. It is
Hmm.
nothing new for us. So,
Yes,
and dealing with the condition as soon as you get that is easier than making it chronic and
medic.
to us.
Yes. Do you think that allopathy and Ayurveda can go together? Because if somebody
Of
is
course.
taking BP medicine regularly and they come for Ayurvedic treatment, they will always have a doubt whether I should take both or if I leave that, they will have that mind blockage. If I should, what if I leave this medicine for some time? So, what do you have to say about it?
Actually, both the disciplinaries are equally good today. For today's era, what we are standing, there are a lot of things which Ayurveda cannot do. Maybe in the surgery, as I said already, that
Yes,
Nalanda University it burnt lot of our manuscript mainly on the surgery part.
yes.
So that is where we are lacking today. Although we have everything, but we don't have anesthetic part in our stream now. So
Hmm.
that
Hmm.
is where we require modern approach. We require allopathic approach.
Al-
And during the emergency, of course, allopathy, they are doing fantastic in their stream.
So if somebody is taking Ayurveda medicine for some particular ailment and they are also taking allopathy medicine, both can be continued together?
Yes, it can be, but again, the doctor has to be well versed in the science, what I say here. They
Yes.
should know what is the history of the patient, since how long he has been taking
Hmm.
modern medications, and what are the
Hmm.
modification in his lifestyle has to be done
Yes.
for to it is more suitable in that way than
Hmm.
just approaching it in one way. If someone comes to me of 220 100 bp, I would suggest like go for allopathy medicine for 3 4 months. Once
Hmm.
your bp blood pressure comes down, eventually we can stop the allopathy medicine, and eventually we can even taper the ayurveda medications once you switch to your lifestyle, and
Yes.
this requires at least 6 to 8 months of your time.
6 to 8 months of the time.
Correct.
Okay. As you rightly brought about the lifestyles, now we see a lot of lifestyles has been changed in all modalities, surroundings, especially when coming to food habits. What is that as an Ayurvedic doctor you recommend to avoid few foods and recommend few foods to be taken?
Yeah,
In
avoid
general. In
whatever
general.
comes from outside, just avoid it. It could be packed food, it could be hotel food, whatever is not cooked in your this thing, Agni
Hmm.
Stapana, where you have done. Don't have that. Better thing. We don't know what kind of mindset those people have. They may be putting some sort of substitute for that. There are a lot of taste makers happening today
Yes,
nowadays.
yes.
A lot of Ajinomoto things are going around. We know all of it. But still, our people are like, we don't have time. We work,
Time.
eat properly, and we don't have time to eat. So that is the, biggest criteria what is happening. And they end up having going for Swiggy and Zomato. So
As you
whatever
said,
comes from outside,
again,
avoid it. It could be packed food, it could be, Tetra packed, preservative, highly preservative food, or it's something which comes directly from the restaurant to your room. So avoid all those things.
as you said, we work for food and we don't have
We
time
don't.
to sit and
Absolutely.
eat. Can you suggest what are the right timings for the people to eat and at what time?
Eating definitely depends on the time you wake up. Because
Hmm.
nowadays, what is happening, there is a shift in the biological clock of the people. That is where a lot of ailments are coming up.
Yes.
Earlier, people used to wake up by 5, everybody would be up. All the village people, town, everybody would be up.
Yes.
Nowadays, it has become a fashion that waking late is a trend now. You
Yes.
ask any youngster, they would suggest that, no, ma'am, I want to sleep till 9 o'clock because I need to study in the night,
Hmm.
late nights.
Yes. It has completely changed.
And
Yes.
even the working parents or working people, they feel that that is more comfortable, and which is slowly impacting their endocrine systems, slowly impacting their liver, everything. So that is where, so at least wake up by 6, if not by 5, wake up by 6. Your endocrine glands has to align accordingly. You have to align yourself with the universe first.
Yes. That is when again the Panch
Yeah,
Mahabhutas come.
correct.
Whether it is Vastu or whether it is Ayurveda,
Yeah.
it is all about that
All about the
Panch
universe.
Panch
You have
Mahabhutas.
to
Yes.
align yourself with the universe. And once you wake up, if you wake up by 6, at least try having your breakfast by 9.
Hmm.
Don't
So it
go beyond.
depends on how soon the person wakes up early
Right.
in the morning.
So there are people like who do sadhanas, there are people who go for running, there are people who go for yoga, everything. They wake up really early, like 4 o'clock. For them, I would suggest please have your breakfast before 7:30 or 8, because don't give too much of gap for your body also. A lot of things are happening like intermittent fasting,
Yes.
some sort of keto diets and all of that. All the fashions you can see in the diet nowadays, which is affecting your immune system, which people are not realizing, and they give that window of 16 hours one day, 12 hours another
12
day,
hours.
and they mess up with their system completely. They end up having IBS, they end up having gastritis.
Hmm.
A lot of things to address it, we require allopath. Sometimes they may be or they may fail to address these conditions, but in Ayurveda, at least we require a good amount of 15 to 20 days at least, and it damages your system. So better not to get your system damaged. Instead, work according to the, instead of sleeping, I'm trying to tell, instead of sleeping late night, better to wake up early
Wake up
and
early.
sleep as early as possible.
Yes, yes. And here I want to ask one more thing, that when people take Ayurvedic medicine, is there any particular dietary recommendations which you give to follow? Any
Of course.
restrictions on diet?
Yeah, because Ayurveda, every ailment, every body type, every individual, they are supposed to follow Patya. Patya is the diet. The
Hmm.
diet would be different if three people come to me with the same blood pressure complaint. For them, the diet would be different. Unlike the dietitians, what we see in the modern science, here completely depends on your body constitution. If suppose take an example of Indian gooseberry or the
Hmm.
amla.
Hmm.
It could be good for some people. Like if you are belonging to the Pitta Prakriti, of course it is very good for you. The same amla for the diabetes, I cannot give for someone
Okay.
who is having Jala Tattva in them more. Someone
Hmm.
who is of Kapha Prakriti, I can't suggest the same thing. So the dietary chart completely varies according to the individual, according to the ailments, and you have to follow the Patya in Ayurveda.
So here the Vata, Pitta, and Kapha plays a
Yeah,
major role in the
major
cycle.
role. So Ayurveda is like if you follow the patya, you don't get the disease.
Many people don't know what is the nature of their body, whether it is
Yeah,
Vata,
correct.
Pitta, or
So
Kapha.
that you have to get diagnosed from your Ayurveda physician, because all of us are individual. When even the twin born are individuals, they don't have the same body prakriti. There will be
Yes.
changes, and I've been seeing that many of the twins I have been seeing them, identical twins also, but still their body nature would be different. So again, the
Like
medicine
earlier,
will be changed for them. The patya or the diet procedures will be changed. Routine we have to change for them.
hmm,
It's like customizing each and every patient.
yes, yes, it has to be customized according to the
Correct.
individual's
Mm.
health plan or what all the ailments they will be having already.
Right.
Like we talked about lifestyle and other things, I want to ask, what do you suggest for youngsters when they think of Ayurveda? Like especially nowadays, we see a lot of kids who are hyperactive, lot of kids who have little delay in speech also. Nowadays, we see that as a very common thing. Does Ayurveda offer something for those type of kids also? Nowadays, hyperactivity is a most common issue among kids.
Hyperactivity, why it happens? Because if the Garbha Samskara is not done properly, that
Hmm.
is where the newborn or the offspring would be having these problems. If Garbha
Hmm.
Samskara is done properly and proper antenatal care has been
They did.
taken,
Hmm.
definitely it won't end up. And if it is already done, the damage is already done, better take that kid as early as possible to your nearby Ayurveda therapist or Ayurveda consulting physician. Because lot of therapies are there in Ayurveda, not just ADHD or speech disorder, milestone problems. All of it can be, addressed very easily. And
Hmm.
simultaneously, you can go for speech therapy or the motor skill development workshops and all those things, which would be, definitely helping the patient more. So
Does
here,
food
what I
also cause
suggest
to
young,
ADHD?
uh,
Does food also contribute to
yes, of course.
ADHD?
The pregnancy antenatal care during in Ayurveda, it is strictly told already that if you don't follow these things,
Hmm.
definitely you end up having the child like this.
Hmm.
It's
Hmm.
already dead. If you starve yourself in the fifth month, definitely the buddhi of the fetus would be less compared to the other kids. If you don't have certain diets, if you don't follow these things, if you overdo something, if you keep traveling on
Traveling.
something, there could be a chances that there would be some problem related to the heart or the mind. Depending on it is very clear cut, depending on the trimester, depending on the month to month, it has been dealt wonderfully.
So presently here, what kind of a patients do you see commonly coming to ICU?
Commonly, we see a lot of arthritis patient, a lot of spinal related patient, because all of them are IT related. They keep working
Yes.
for 12 hours a day, 14 hours crazily, along with traveling every day. We see a lot of lumbar disc prolapse, spine, cervical thing due to overuse of.
And especially people in Bangalore, they suffer due to traffic also
Yeah,
traveling,
that
driving
is
for two
added.
hours.
So lot of ear issues also we are seeing some nowadays. Lot of vertigo kind of things that we are seeing due to overexposure to the iPods and all those things.
Hmm.
Uh, PCOS is like, earlier
Very
10
common.
out of 10 of female patient, if they come, hardly two patient would be having PCOS. Now
Hmm.
every other female
Yes.
is having PCOS, and fertility is dropping like anything. One thing could be due to the delay marriage system, what is happening nowadays.
And even the sperm count also gets very low
Yeah,
these days.
it is getting. But the male factor, to deal with the male factor is comparatively easily compared to the female factors.
Hmm.
Because every month, because if there is some problem, morbidity, mortality of the sperm, it is easy for us to work on. Within 6 months, we can find some changes. But in case of the female, We cannot do that because one thing, they will be playing with the biological clock. They won't be getting up early. The second thing, the sedentary lifestyle. Even if they go for the gym, they will gym for 1 hour and rest
Yes.
2 to 3 hours. They are sedentary.
Hmm.
And too spicy eating outside food, lot of food which have lot of vinegar in it. All of it are affecting their fertility without their knowledge, and there is no proper fruits in their diet. People eat all the exotic
Uh,
fruit, which is not suitable for us. They don't realize that.
hmm.
They don't
What
want
is
to.
available and what is suitable to their
Correct.
body, that they
What
should
is
use.
grown in the local, they don't want to have those fruits. They want to have some exotic dragon fruit, kiwi fruit, something and all.
That
So,
also adds to fashion, I guess,
yeah,
to
of course, those all fashion fruits are as for the health of the people.
Hmm.
Dragon fruit, I found that one of my patient had a huge issue of phlegm sinusitis. Upon thorough examination, I could find out that it was due to the dragon fruit. And one patient was having so much of seeds. They soak it in the night, they take up in the morning. That is good only for the certain people. Again, the Deha Prakriti has to be analyzed and has to be advised according to the Deha Prakriti. She developed so much of swelling just by,
of chia seeds, because
yeah,
of
yeah.
overtaking of
She
chia seeds.
was belonging to the Kapha Prakriti and she was taking chia seeds from past 15 days almost. She had developed so much of swelling in and around the eye sockets, and she had gone to multiple dermatologists also, but none of them could find out what was the reason. They thought that it
But
could.
nowadays, chia seeds has been taken very
Yeah,
commonly
that's
by
what. It's
people.
all fashion nowadays, what is happening. Just a YouTuber or an influencer comes and suggests you, you
Yes,
blindly follow that, even without knowing whether
we should say
your
they all
body
follow
can take
YouTube
it or
doctors.
not.
They all follow YouTube doctors.
Yeah, yeah. A lot of you can find them very much nowadays. So
As
that
we talked about PCOS and other female health issues, one more thing which we see is females who are in mid 40s, they go through a lot of emotional imbalances when they are approaching their menopause. Any suggestions how they can handle those?
the menopause is something which will be natural for your body. You need to prepare mentally yourself more here. So mentally you should grace that change happening in you.
Because I have seen many females who are in the mid 40s, they go more emotional or more depressed during that phase. Is it the signs that menopause is approaching, or how does someone identify those phases?
When a female of 40 or 42 comes, definitely they will be having a teenager daughter or a teenager son. So
Hmm.
their emotion will be playing on them first thing. They
Yes.
have been like 30 years or 20 years, they have given themselves to build a family, and they are now neglected. And the another most important conception what comes to the female once they reach this 40s and nearby 42, 43 is that they think that they become sexually inactive once they hit the menopause. So
Yes.
somewhere deep inside them, they have this thought process and they feel very inferior. So that is why they develop so much of, anxiety issues, mood swings, hot flushes. You have to grace it, you have to take it. It's no way that you cannot, you can hide from it, from the
Yes.
nature. You have to take it with the grace. And there are like, many of the Ayurveda medications which will be helpful. There are people who may go into depression as well.
Yes.
So
Does
address it
Ayurveda help
clinically.
in mental and emotional
Yeah,
health also?
yeah, it helps because all of it are plant derived. So one thing, when it is a plant derived, definitely your sattva guna in your body will increase. So
Hmm.
that is how your mental peace is more compared to any system of medicine.
Hmm.
Emotionally, you'll be much more stronger than any of the parallel medicines because directly your sattva guna in your body increases rather than the rajo and tamo guna in your body.
So, like one more thing, one another sensitive issue which I want to take the opportunity to ask you is, as we talked about menopause and other things, there is another issue which is coming up now is very early puberty in the females, like
Hmm.
8 years, 9 years, or 10 years. Earlier, the age limit used to be 14 or
14,
maybe
13.
13. Yes. So that also is related to food habits, or how do you see that?
See, puberty, it is happening for two reasons. One is people are having too much of non-vegetarians nowadays.
Hmm.
They're becoming too much, like, earlier days, at least 10, 20 years back, at least they used to see that only on Wednesdays or only on Fridays, they were
Produce.
supposed to have non-vegetarians. Now it has become a fashion that entire week they keep hogging onto the non-vegetarian
So
things.
you mean to say
And
that
we don't know.
non-vegetarian food ignite
Correct.
early
All these
puberty?
poultry products, they come with the injected things with them. All the
Hmm.
progesterones will be injected for to make them chubby, everything for that
Hmm.
chicken to look. So they are taking it directly. So one is that reason. The second thing is too much of intake of this coca, too much of
Okay.
chocolate,
Hmm.
which they
So
shouldn't
what
be
would be
taking.
your suggestions or simpler tips for mothers who have daughters of 6 or 7 years, so they can prevent them not to go through all these in the very early stages of their life?
Avoid dairy as much as dairy doesn't mean your ghee, but avoid the milk. What we get processed milk, we don't know which animal's milk it is. We don't know whether it is a cow's milk or a buffalo milk. Everything is, mixed, made to certain, gravity or something like that, and it is packed completely and given to us. We don't know. So until and unless it is a A2 milk or organic milk, please go for that. Apart from that, don't go for it. At least once the girl is of 7 years, stop it for 2 years. But better
Okay,
go
that
with
can be
only
one of the
ghee.
options. That
Yeah,
can be one of the options to
it
stop
can
it.
be one. But go with the ghee. Don't stop the ghee. No matter if it is cows or the buffalo, because the ghee is something which is finely processed. So it
A
is
lot of
good.
people have many misconceptions about the ghee. Would you like to say something about it?
Ghee is the holistic thing according to Ayurveda. We are all
Yes.
having one thing which is different from the other, although we may be of same color, same texture, we belong to the same continent. There is something called as ojas inside us, which make us different. And to increase
Yes.
this ojas, the ghee is the only thing. To
Yes.
increase our aura also we require ghee, intake
Mm,
of ghee. It like we in Ayurveda we have saptadhatu like
mm.
rasa rakta mamsa meda asti maja. All our
Yes.
body is being divided into seven things. What we
Yes.
eat, it reflects on all these seven body constitution,
Mm.
and ghee is one such thing which nourishes all these seven things till the
As a
sem
doc, as
from
we
the
talked about various things in Ayurveda, as a doctor, how do you think Ayurveda is spreading to people nowadays?
Ayurveda, yes, definitely it's spreading. Once it comes from the Western mouth, definitely whatever it is, it will spread. So now Westerners are more keen on learning Ayurveda. I have two of my students who are in Korea, and they are more keen than the kids who are studying BAMS here in India. So they want to know, they want to explore more. Once something comes from the Western, automatically
So
our people will take up.
what we can do to preserve these kind of ancient cultures and ancient health modalities which was fading away, how it can be preserved for our coming generations?
See, preservation here I can say in 2 points. One thing is, yes, of course, you have to adapt it. First,
Yes.
you should take it. This is something, this science is not derived from human beings. Unlike other, you take homeopathy, you take
Yes.
naturopathy, you take allopathy, all of it is are derived from humans. But this is something which is given by God to the sages. It is
Yes.
preserved from the generation to generation. It has a history of fire. See, whatever materials we have today, that only we are not able to digest because it is so vast, so spreaded, and whatever sort of disease you come up, even in during COVID, we call it as Janapada Dvamsa in Ayurveda. In India or any part of the world, we have been seeing this all
Seeing this. Yes.
epidemic, endemic. We have been seeing, and we have been evolving all these epidemic, endemic. It was possible only through the Ayurveda. So
And you think
first
that
thing,
after
adapting ourselves for Ayurveda. First see if for everything antibiotic is not the answer.
our times,
First
yes,
see if your body is not able to accept or if you don't find a proper Ayurvedic doctor, then go for the allopathy. When there is an emergency, please go. I'm not saying that don't go, but just give some time for yourself, for your immunity to build. The second thing, what I want to say is encourage the youngsters to take up Ayurveda.
yes,
It's a
encourage it.
Yes, encouragement has to come from the family because this course is almost about 5.5 years. The initial BAMS course is itself 5.5 years. Plus MD, it takes another 3 years. So it is not less than an MBBS doctors. We have to, I can say that we
So
have
we should be
more
encouraging the
than
youngsters to
BAMS doctors.
take up more Ayurveda practitioners
Yes,
in
they
the
have
doctor
to. And
education.
once they read BMS or once they go through Ayurveda, they have to stick to Ayurveda. It's not that they,
Mm.
just for the sake of making money, they have to go for the parallel sciences.
Yes, yes. And one more thing before we end, many people believe it takes time in your Ayurveda to cure. How true or how not true it is?
See, first thing, why I took up Ayurveda because initially even I was skeptic when I started practicing whether Ayurveda is really going to work because I was doing all single-handedly. But once I started practicing, I could notice that within a span of 7 to 15 days, I could see a maximum changes wherein the antibiotics were required. All of the cases were, getting relief
Yes.
so well, and the immunity used to get so well. So I made it a point that if I want to work in Ayurveda, I have to spread this message to each and everyone that Ayurveda is completely not slow. It is really fast. See, I'm getting all sort of chronic ailment. It's nothing like you get a knee joint pain
Yes.
and you come to me immediately. You come to me after 15 years.
After
You have
years,
been
yes.
visited multiple doctors, you have taken multiple opinions. Lastly, your surgeon will say that surgery is the only option. And that is the time when you turn up to me. So,
Hmm.
and in all such cases, I've been able to deliver my best within the span of 45 to 60 days. All sort of chronic ailments,
Very
it
good.
could be sinusitis, migraine, PCOS, spinal surgeries, all of it, we are able to do it excellently
Like you
well.
talked about sinusitis and migraine, that is very
Mm.
common among children also these days.
Due to the, too much of having something refrigerated,
Hmm.
easy to take, and too much of curd, taking intake of curd is one more thing, and too much exposure to the AC. Wherein, if we live in something like Bangalore, we don't require AC here, but
Yes.
still kids are
Children,
so used to AC, they
yes,
don't want to
yes.
breathe the natural thing. So that
Hmm.
is how sinusitis and migraines have been developing so fast. And the second thing is too much of screen time,
Too
which
much of strain.
too
Yes.
much of screen time, which is not at all required.
Like in Ayurveda, there are few therapies which you do, like Natsya,
Yeah.
Panchakarma therapies, Shirodhara, and maybe you might be knowing endless number of names. Can you suggest one or two quickly and what it is the useful for what kind of a treatment?
See, Panchakarma is something which is done even for the healthy people. It is not that you fall sick and then you come to
Then,
take Panchakarma. Panchakarma is like servicing your body. The way you service your vehicle, service your body once in a while, at least once in a year. Take up some sort of Panchakarma therapy. I mean, it is itself a huge
so
stream.
it can be taken by everybody, even a healthy person.
Everybody, including the healthy people, unhealthy people, ailment related thing, everything. But if you're a healthy people, I would suggest to see Ayurveda came to, longify your health.
Yes,
Longevity was something which was there always, because all the rishis and seers, they didn't wanted to die up after 100 years. They wanted to live for 600 years, 700 years, so that whatever they learned, they had to transfer it to their disciples. So that
yes.
is why living long was something which is very important in Ayurveda. And that's how Panchakarma started, Rasayana Shastra started. So Panchakarma is something to improve our health, to live long. So first thing is that, and the second thing is, of course, it can address all sorts of ailments, all sort of chronic ailments, gastritis, IBS, whatever we see today,
It can be taken by all the age groups.
all the age group. Some of it comes in contraindication, like I can't give Virechna for 7 years or 5 years old kid.
Yes. Mm.
So some of it, yes, for all the age groups I can do. And if you want to try something, I would suggest all of you can go with Shirodhara. Shirodhara is something which is really passive.
Very ancient. Yes, it's one of the
Yes.
very oldest ancient techniques in Ayurveda.
Technique to soothen your system, brain system, and more importantly, soothing your mental stress. It is something which will
Yeah.
act on your hypothalamus and pituitary glands.
Mm.
So all the impairments what we are seeing today is mainly because of our hypothalamus and pituitary gland. So even in case of PCOS, it is an excellent remedy.
As you talked about longevity, I see a huge buzzing around us these days. Like people want to know how to live longer. The longevity is also another hot topic these days. Can Ayurveda contribute to live longer?
Ayurveda have an entire stream called as Rasayana Shastra only for longevity of life. All this
Mm.
Chavanpraj, whatever you had been taking during the COVID, is one such thing, minute thing taken out from the Rasayana Shastra and given to you. So it's mainly to improve your health as well as the quality of health. Living
Thank you,
without the
doctor. Thank
ailment
you.
is something more important than living on the bed, cribbing every
Mm.
day for,
Every day.
every single day,
Yes.
rather than live and be helpful for the society. You
Yes.
are here to pass on something.
Mm.
It could be the knowledge, it could be some sort of asset you will be having. It is for the society, not just for you. And for that, longevity is more required. No matter how successful your business people you are,
Business.
if you end up in the, hospital, it's of no use.
No use. Yes. As we say, health is wealth, and first way
Correct.
to is to approach Ayurveda and live longer life.
Correct.
Any one message which you want to give our audience? It can be general, it can be related to Ayurveda, anything.
Trust Ayurveda because something gods have trusted. It is a God-given science. Trust Ayurveda. It's not something I have been telling or some other Ayurvedic doctor telling. It's something which is being practiced by our Ashwini Kumaras. Ashwini Kumaras are direct son of Surya Narayana. So it is something which is from there we have been getting it from there, from Lord Dhanvantri. We all know Samudra Mantana, why it happened, how it happened. So Dhanvantri is something who evolved out of the ocean with two things in his hand. One was the Amrita for the gods,
Amrit,
the
yes.
second thing was Ayurveda for the human beings. So it is something for us. So we have to take up Ayurveda. It's a high time, though it is an older thing. For tomorrow, it is the most essential thing.
Most. Yes, very, very rightly said, Dr. Sindhu, that trust the science, trust Ayurveda.
Correct.
Thank
And
you
go
for
with
giving
the
us
basic
your
whenever you get
valuable time
a
today.
low immune or whenever due to the seasonal thing, whenever you get too much of cold, running nose, just try Ayurveda at that point so that you gain some trust and later on you can ask your people or you yourself can see to all these rejuvenation process.
So we have to trust the process and trust the
Correct,
science to
correct.
get the results. Thank you, ma'am. Thank you
Thank
for
you.
coming here, taking your valuable time and sharing such a wonderful insights on many misconceptions about Ayurveda. So thank you so much.
Thanks a lot for all the viewers and especially for you to come up with something really, oh, I can say it takes a lot of time for you also to go through all the multiple disciplinaries, prepare yourself, ask the question, everything,
Yes.
and your efforts is like, I cannot tell how much of efforts you are doing for this job.
Thank you. In this
I really
process, I also got
appreciate your
to
knowledge
learn,
and your enthusiasm that you are coming up with such a great thing on the platform which can be spread to the everyone, each and everyone.
because
Thanks
this is the
for
way,
giving me
as
the
you said,
opportunity.
that we should spread this to our younger
Correct,
generation.
correct,
Maybe this can be one of the smallest thing which I can do to
correct,
spread
correct.
this. Thank you.
Right. Somewhere, if we inspire someone to take up Ayurveda or our Shastras, it could be Yoga Shastra, Natya Shastra, or anything,
And
then
Vastu Shastra.
Vastu Shastra, exactly. So that is where the purpose is meant, our life purpose is meant.
Yes,
That
yes.
is how it is going from generation to generation. It's not that I read and I keep it to my room. It
Yes.
has to be
Let's
spread in
all
society.
come together to spread this knowledge to our coming
Correct.
generation, to our younger generations. Thank you, ma'am. And thank you, everybody, for watching this wonderful podcast with Dr. Shindu. If anybody wants to get connected with her, please join the WhatsApp link in the description. And I'll be bringing more experts, more deep insights into much more coming up in this full December. Keep watching our channel. Thank you and namaste, everyone.
Thank you. Thank you.